CCRN Musculoskeletal Practice Test Questions Study Guide Review, 35 Essential Questions. Question 1. A patient with a lower extremity fracture develops sudden onset of extreme pain, out of proportion to the injury, and paresthesia. What should the nurse suspect? Deep vein thrombosis, compartment syndrome, fat embolism syndrome, osteomyelitis. Pain out of proportion and paresthesia are early signs of compartment syndrome, a surgical emergency. Question 2. Which P is a late sign of compartment syndrome? Pain, paresthesia, pulselessness, pressure. Pulselessness and paralysis are late signs indicating severe ischemia and tissue death. Question 3. A patient with a femur fracture suddenly becomes confused, tachypneic, and develops petechiae on the neck and chest. What is the most likely diagnosis? Pulmonary embolism, fat embolism syndrome, hypovolemic shock, pneumonia. Petechiae, in a vest distribution, is a classic, though late, sign of fat embolism syndrome following long bone fractures. Question 4. What is the primary goal of skeletal traction? To immobilize the joint for 24 hours. To provide long-term alignment and reduction of a fracture. To allow the patient to walk. To prevent skin breakdown. Skeletal traction uses pins or wires to apply a heavy pull directly to the bone for alignment. Question 5. In a patient with rhabdomyolysis, the nurse should closely monitor for which life-threatening complication: liver failure, acute kidney injury, AACN, diabetes insipidus, hypertension. Myoglobin released from damaged muscle is toxic to the renal tubules, leading to AACN. Question 6. Which electrolyte abnormality is commonly seen in rhabdomyolysis? Hypokalemia, hyperkalemia, hypernatremia, hypophosphatemia. Cellular breakdown releases potassium into the bloodstream, leading to hyperkalemia. Question 7. When assessing a patient in traction, the weights should be: resting on the floor, hanging freely, lifted when the patient is moved, removed once an hour. For traction to be effective, weights must hang freely and never touch the floor. Question 8. What is the treatment of choice for acute compartment syndrome? Elevation of the limb above the heart, ice packs and compression, fasciotomy, cast application. A fasciotomy is an emergency surgical procedure to relieve the pressure in the muscle compartment. Question 9. The golden hour in trauma refers to the hour before the injury, the first 60 minutes after injury when intervention is most critical, the time spent in surgery, the time it takes for a bone to heal. The first hour post-injury is critical for survival in major trauma. Question 10. A positive Phalen's test is indicative of rotator cuff tear, carpal tunnel syndrome, ACL tear, herniated disc. Phalen's test, wrist flexion, reproduces numbness/tingling in carpal tunnel syndrome. Question 11. Which of the following is a symptom of a hip fracture in an elderly patient? Internal rotation of the affected leg, shortening and external rotation of the affected leg, lengthening of the affected leg, absence of pain. External rotation and shortening are classic clinical findings of a fractured hip. Question 12. The nurse notes a crepitus during a musculoskeletal assessment. This is a normal finding, a grating sound or feeling of bone rubbing on bone, a type of skin rash, a muscle spasm. Crepitus indicates bone-on-bone friction or air in subcutaneous tissues. Question 13. Osteomyelitis is an infection of the muscle, bone, joint, skin. Osteomyelitis is a severe infection of the bone marrow and surrounding tissue. Question 14. What is the purpose of an ORIF, open reduction internal fixation. To apply a cast. To surgically realign and secure a fracture with hardware. To remove a limb. To stretch the muscles. ORIF involves surgery to open the site, reduce the fracture, and fix it with pins/plates/screws. Question 15. Bucks traction is a type of skeletal traction, skin traction, cervical traction, internal fixation. Bucks traction is a common skin traction used for hip and femur fractures before surgery. Question 16. A closed fracture means the bone is completely shattered. The skin over the fracture site remains intact. The fracture is in the skull. The bone is protruding through the skin. In a closed, simple fracture, there is no break in the skin. Question 17. What does reduction of a fracture mean? Reducing the amount of pain, realignment of the broken bone ends, shrinking the bone, applying a smaller cast. Reduction is the process of setting a broken bone into its proper alignment. Question 18. A patient is at risk for a PE after a hip replacement. Which medication is most likely ordered for prophylaxis? Aspirin, enoxaparin, acetaminophen, furosemide. Enoxaparin, Lovenox, is a low-molecular weight heparin used for DVT/PE prophylaxis. Question 19. Total hip arthroplasty. The patients should avoid which movement post-op? Walking, adduction and internal rotation, abduction, sitting in a high chair. Adduction, crossing legs, and internal rotation can cause hip dislocation after the. Question 20. The Lockman test is used to evaluate the integrity of which structure? Rotator cuff, anterior cruciate ligament, ACL, Achilles tendon, meniscus. The Lockman test is the most sensitive clinical test for an ACL tear.